Hello, my name is Harsha. I'm one of the SSM students on laparoscopic and robotic surgery. Today I'll be speaking about laparoscopic ports. I'll just begin by going over the basic principles of laparoscopic procedures. So a small incision is made below the umbilicus, and this is known as the primary port site. Then from this, carbon dioxide gas is pumped into this incision through either a needle or sometimes a tube, or what we can otherwise call a laparoscopic port. This inflates the abdomen, and that allows for an optimal view of the target organs. Then a laparoscope can be inserted through this port, which basically relays images to a television monitor in the operation theatre. Depending on the procedure, we can make further incisions and insert more ports. These are known as secondary ports. After the procedure, the ports can be removed, the carbon dioxide gas can be released from the abdomen, and the incisions will be closed using stitches or clips, and a dressing will be applied. So that's essentially a basic rundown of laparoscopic procedures. Obviously, this is a lot more complicated and will differ according to what procedure is being conducted. This presentation will be focusing mostly on these laparoscopic ports. So what are laparoscopic ports? What makes up a laparoscopic port? I'll also be discussing a little bit about laparoscopic port placement, and then we'll end on kind of some complications that can arise at laparoscopic port sites. So to begin with, what is a laparoscopic port? So what is a laparoscopic port? So these are just some images of some laparoscopic ports. A laparoscopic port is something that allows temporary access across the abdominal wall to facilitate the entry of instruments required for laparoscopic surgery. They come in lots of different materials, shapes and sizes, with different, sometimes, for example, the one on the right here has a little balloon kind of thing at the bottom, whereas this metal one doesn't seem to have that. So there's different parts to lots of different laparoscopic ports out there, but essentially the two main components that make up a laparoscopic port is firstly the trocar and secondly the cannula. So this is the trocar, and then that would be the cannula. We'll go into a little bit more detail into these two different parts that make up a laparoscopic port, and I'll begin by speaking a little bit about the trocar. So what is a trocar? So from the previous picture, you would have realised that the trocar is a little bit more sharper than the cannula, and as you can see in the pictures here, all these kind of trocars have these sharp pointed ends. So essentially, a trocar is a sharp pointed surgical instrument fitted with a cannula, and it's used to insert the cannula into the body cavity. And they come in lots of different shapes and sizes and materials, and there's lots of different categories and classifications of trocars, which I'll briefly cover in a moment. Just before that, inserting a trocar into the abdominal cavity is normally done in a screwdriver motion rather than a stabbing motion, because obviously you don't want to puncture or harm any organs or vessels in the abdomen. And I'll just be going a little bit over the different types of trocars that they are. So there's a wide range of categories and classifications. So for example, there's disposable versus non-disposable trocars. So we have plastic trocars, which I think there was a picture of plastic trocar in the previous slide, and then non-disposable ones like metal ones, and there's loads of them here. There's cutting versus dilating trocars. So cutting trocars essentially have a sharp metal or plastic blade that cuts through various tissue layers, whereas dilating trocars, which are a more new innovation, they tend to have a blunt tip that actually separates and dilates tissue under pressure. This is thought to be better because it minimizes the risk of cutting internal organs. Then also we can classify trocars in terms of size. So we have small trocars, so 5mm, 11mm, 12mm, and there's a wide range. We then also have special trocars like mini ports, hybrid trocars, newest merge port trocars, and these kind of things. Picking what type of trocar you want is probably dependent on the procedure, the surgical preference, and yeah, lots of different factors. So just a little bit more on choosing the right trocar. So this depends, again, as I briefly touched on, the nature of the procedure. So a standard procedure without complications, you can use a smaller size trocar, whereas for more complicated procedures like removing large tumours, you'd want to use a more larger size trocar. Disposable trocars have the advantage that you're guaranteed a sharp tip and an easy insertion process. However, they are more expensive and they are a little bit less environmentally friendly, whereas reusable trocars have that economic advantage. However, they do require greater maintenance, like cleaning, sharpening, and sterilizing. The picture on the top right over here shows you some tips that are present in reusable trocars. The most common tip that is used is a pyramidal tip. And these are, just some pictures of some trocars, and that's a port. You can see the cannula and then the trocar. We've spoken a little bit about the trocar. We're now going to move on to speaking about the cannula, which is an important component that makes up the laparoscopic port. So as you can see on this picture on the right with the white background, this long metal tube is our trocar with the sharp pointed tip, and this white tube is our cannula. This trocar with the white with the sharp tip, as we mentioned before, we use this to insert the cannula into the abdominal wall with a screw driving motion. So after insertion, the central trocar is removed and the remaining cannula functions as an access port for the laparoscopic instruments. So the cannula can be made from plastic or metal. They can come in different sizes and diameters depending on the instrument that you want to use it for, and also depending on the procedure. So the cannula has two very important parts to it. So the first part is the valve, which is found at the top of the cannula. So it's found at the top of the cannula and it acts as an internal air seal, allowing instruments to move in and out within the cannula without the loss of the pneumoperitoneum. So the pneumoperitoneum is just the CO2 that we have in the abdomen. We don't want to release any of that in the midst of moving instruments in and out of the laparoscopic port. So that's why the valve is a very important part of the cannula. And then the second important part of the cannula is the gas vent with the stopcock, and this is basically for gas evacuation, for if we're using any type of diathermy during the procedure. We've touched a little bit on the kind of equipment and instruments you use to set up laparoscopic ports. However, it's also very important to have correct laparoscopic port placement, because this can have an overall effect on the procedure. So correct port placement should not only provide an optimal view of the target organs and operative field, but it should also minimize the mental and muscular fatigue of the surgeon. Normally, the first port or the primary port placement is quite simple. It's a small cut or incision of around 1 to 1.5 centimeters near the umbilicus. This is about the chosen site for 95% of surgeons and gynecologists. However, more complicated procedures may require more port placements, and these are known as secondary ports. The placements of these ports can be a little bit controversial, and they can differ according to the procedure and the surgeon's preference. However, there have been some concepts that have been introduced to help ensure that the correct port placement is chosen. So the baseball diamond concept of port positioning can help with ensuring that the correct secondary port placement is chosen. So this includes three things. So you'd want to make sure that there's an angle of about 60 degrees between two instrument tips. There must also be a tangential approach to the site, and it must also be from an appropriate working distance. So if you keep all these three factors in mind, it can help ensure that you are choosing the right secondary port placement. So there's this picture on the right hand side which shows this. Obviously, there are instances where sometimes you can get incorrect port positioning, and in those cases we can get something called swording. So swording is basically when the telescope or shaft of the assistant's instrument obstructs the surgeon's instrument. And there are a number of things you can do to correct this. For example, repositioning retracting instruments, rotation of an angled telescope, allowing alteration of the position of the end of the telescope, withdrawal of the telescope, you can transposition of the operator's instruments, you can put in additional ports, or you can change the instruments to a different port. So although there are a number of things you can do to correct incorrect port positioning, it's obviously advised to be mindful of the placement of your secondary ports, as things like, for example, things like putting in an additional port to correct port positioning can also increase the risks of complications. So it's just important to not only have good technique of inserting ports, but also have good understanding of the anatomy and good understanding of port placement according to procedure. For example, on the right hand side, you can see this. I've just put up two pictures of the different laparoscopic port placement sites for different procedures. So on the top we have port position for a diagnostic laparoscopy, and then on the bottom you can see how the port placement differs if you were going to do a procedure for a bilateral hernia, LAVH, or for most gynecological procedures. So that's something to bear in mind when you are thinking of laparoscopic ports and their placement. So I briefly touched on this in the previous slide, but sometimes we can get laparoscopic port complications, and some of these complications include port site bleeding, port site infection. You can get port site hernias, and an increase in the size of the port site incision and trocar, and an increased number of ports has shown to increase the chance of complications, as I mentioned in the previous slide. However, on the bright side, port site complications are actually very rare, and if they do occur, they're usually manageable, and they don't cause too much discomfort. And we can actually further reduce these complications by using precise surgical techniques during entry and exit, and being very mindful of our laparoscopic port site placements. So that brings me to the end of my presentation on laparoscopic ports. Thank you so much for listening.